Osteoporosis Part 2. Pharmacological interventions. Bisphosphonates, such as Alendronate and Risedronate, are used as first line to treat osteoporosis. They prevent bone resorption by inhibiting osteoclasts and prevent further bone breakdown. Bisphosphonates are also used in Paget's disease, which is a chronic bone disorder that results in weakened bones, and they are also used in malignancy-related hypercalcemia or elevated calcium level in the blood. For example, Zoledronic acid is an IV bisphosphonate used to treat hypercalcemia or bone pain caused by bone metastases from cancers. The two main things to know about bisphosphonates are increased risk of esophagitis and osteonecrosis of the jaw. With oral bisphosphonate, if the tablet gets stuck and sits against the mucosa of the esophagus, it damages the protective lining of the esophagus and causes inflammation of the esophagus, called esophagitis. And that can lead to ulceration and perforation of the esophagus. So it is very important to educate patients to take oral bisphosphonates on an empty stomach in the morning with a full glass of water to make sure the tablet doesn't get stuck in the esophagus, and sit in an upright position for at least 30 minutes to prevent reflux. Osteonecrosis of the jaw is a rare adverse effect of medications that inhibits bone resorption. It causes necrosis or death of bone cells in the jaw and results in jaw pain and infection. It is recommended to get a dental exam prior to the start of the medication and periodically throughout. Calcitonin is a hypoglycemic agent that prevents bone resorption and promotes renal excretion of calcium. It is given intranasally or subcutaneously. The main thing to monitor for is hypocalcemia or low calcium level in the blood. Classic signs of hypocalcemia include Trousseau's sign and Chvostek's sign. Trousseau's sign refers to the involuntary flexion of wrist and thumb and extension of fingers when a blood pressure cuff is inflated on the arm. Chvostek's sign refers to a twitch of the facial muscles that occurs when gently tapping a patient's cheek. They both occur because of hyperexcitability of the nerves due to low calcium level. Hormone replacement therapy with Tamoxifen or Raloxifene are used for osteoporosis caused by postmenopausal loss of estrogen. They work by binding to estrogen receptors and have estrogen activity in bone and prevents bone loss. They are not used as first-line therapy because of increased risk of blood clots. Other side effects include hot flashes and leg cramps. Denosumab is a monoclonal antibody that inhibits osteoclasts maturation and bone resorption. It is used in those with high risk for fractures who failed first-line osteoporosis treatment such as bisphosphonate, and those who have bone pain, fractures, and hypercalcemia due to malignancy. Denosumab is given as a subcutaneous injection every 6 months. Just like bisphosphonate, osteonecrosis of the jaw can occur, and patients should be getting routine dental exams while on this medication. No matter what osteoporosis medications are prescribed, patients should take vitamin D and calcium supplements to maintain bone health. The main side effect of calcium supplement is constipation. In summary, bisphosphonates are the first-line treatment for osteoporosis. Monitor for esophagitis and osteonecrosis of the jaw. Measures to prevent esophagitis include taking bisphosphonate on an empty stomach with a full glass of water. Sit upright for 30 minutes after. Routine dental exams are recommended to monitor for osteonecrosis of the jaw. Monitor for hypocalcemia with calcitonin such as Trousseau's sign and Chvostek's sign. Monitor for blood clots if patients are on hormone replacement therapy such as Tamoxifen for postmenopausal osteoporosis. Denosumab is an immunotherapy reserved for those who failed. Other osteoporosis treatment and osteonecrosis of the jaw can also occur.